Okay, so this is part two of the pulmonary disease presentation. I tried to do it on Skype, but it wouldn't work, so I'm going to try this other app and see if it's any better. So let's continue on with the two pulmonary diseases that we're going to talk about is our asthma. Your case study will be about asthma, and we're going to also talk about chronic obstructive pulmonary disease. When we do our projects, some of your classmates may be working on some other pulmonary diseases. But for today, part two of this lecture will be asthma and COPD, so let's get to it. So here's your case study. Maybe you've already seen it. This week's discussion, I do want you to do a little bit of research. This case study says many children with asthma are sidelined from sports because of fear of triggering an asthma attack. So I want you to think about that or research the thought, can individuals with asthma compete in sports? And I would like you to back it up with some evidence, some research evidence and some citations. And what sports may be the best choice for individuals? Same thing here, so find out a little bit more about it, why certain sports may be better than other sports and what types of sports you would select. And then see if there's any research that you can find on high-level athletes and asthma, what's been documented about that. So what I'd like you to get in this week is to bring some new information to the group, share it with your classmates. You could also, if you have first-hand experience, personal, or you have experience with family members or friends that have asthma, that would be a good time to bring it up. And then if you can list or find all the current famous celebrities that made athletes that may have that have asthma, that would be great to share with the group. Okay, so that's the plan for this week for the case study. So I'll bring you back to our decision tree for screening participants. So now we're talking about asthma and COPD. So physical activity is still the first part of the decision tree. So you would still ask if they are active, 30 minutes, 3 times a week, for 3 months, moderate intensity. And so you would determine here. You will find that asthma, it is not a cardiovascular, metabolic, or renal disease. COPD, also not a cardiovascular, metabolic, or renal disease. Now, it could be that they have another coexisting condition. It's not unheard of that someone with asthma or with COPD has obesity and diabetes and maybe cardiovascular disease already. So that's something to ask. And but if it's just dealing with a pulmonary disease, you can see that from the decision tree here, it's not a CMR. Now it could be that they have COPD, for example. Let's suppose they're physically active, they have COPD, but they don't have any of this. So they have COPD, so no CMR, but they have currently experiencing some signs and symptoms of cardiovascular disease. So then you would consider that in your decision making. But simply COPD or asthma would not qualify under anything here. They would actually come through to start light to moderate physical activity. Okay, based on this. So what is asthma? All right, so asthma, you may feel like you know a little bit about it, but this is a healthy breathing airway. Airway should look like this. With asthma, it may get inflamed, mucousy, irritated as a response to something in the environment or a trigger. Histamine response many times. And eventually, because it's like this, and it could lead to greater propensity for infections. So as far as how it's defined, asthma is a chronic inflammatory lung disease. Next week, we'll talk about cardiovascular disease and how that sometimes is also defined as an inflammatory disease. 6 million children and 25 million people overall affected. And you'll tell me about athletes in your case study discussion. The primary symptom is difficulty breathing due to narrowing of the airways. best description I've heard is, I have even tried it, it's trying to breathe out of a straw club. Hold your nose and put a straw in your mouth and try to breathe just through that, and then attempt to exercise breathing through the straw. So it's not very much fun, doesn't feel well, leads to folks being, if it's exercise induced asthma, folks afraid to exercise because they're afraid of the onset of an asthma attack. Although the prognosis is good, deaths from asthma attack is uncommon, but bronchorestricting response to exercise does occur in 90% of individuals with asthma. So if they have asthma, especially as exercise intensities increase, it is very possible that they would experience an attack. And so that's what we want to consider. Bronchial inflammation results in airway obstruction that leads to wheezing, breathlessness, chest tightness, and coughing. And if you've ever had a really bad lower respiratory cold, like bronchitis, infection, it doesn't feel very well. It's sometimes very scary. So chronic inflammation being the culprit results in that airway remodeling. Again, that's what you see in figure 5.1 that I showed you earlier. And it makes breathing rather difficult and challenging as a result. On asthma attacks, you will hear people with asthma, those that are caretakers of someone with asthma. That's what you try to prevent, an asthma attack. So it is due to a trigger histamine response that occurs, overreacting histamine response. In severe cases, for someone who has very strong or very serious allergies, for example, peanut allergies, the histamine response is so severe that they may need an epinephrine pin in order to open up the airways again, because it constricts completely, and so they can go into respiratory arrest, and that's a life-threatening condition. So what could be a trigger? Pets, you see a whole bunch of different things could be a trigger. So when we talk about, let me move myself over here to the side. When we talk about exercise is up here. It is not an allergen trip, but it could also be a trigger for folks that have asthma. Okay, let me maybe move myself up and see how that works now. Okay, so inflammation is not it's the culprit. Mucus is produced, interferes with air movement. Many folks with asthma will also have several allergies, so there's already dealing with all of that nasal drainage and mucus that occurs. Bronchoconstriction, smooth muscle layer constricts, narrows the lumen and complicates breathing as well. Reduced airflow into the air sacs that we spoke about in the first part. And the end result is that body tissues are deprived of oxygen. So in very serious attacks of asthma, you may also check oxygen saturation rate with the finger. Something goes in your finger, and ideally it's in the 90s, but it means that you're getting enough oxygen. But for those that have severe pneumonia or breathing diseases, it may be very low, like in the 80s, and so you're not getting enough oxygen to all the tissues of the body, and that's not good. So, criteria for defining the severity of asthma, it depends on how many incidents you have. And so, obviously, the more often it happens, if you look at this chart, the more often it happens, and the more severe you're limited, the more serious it is. This is from the spirometer, the thing you breathe into. So this is what it's talking about for the forced expiratory ventilation, or PFV. So you can see the distinction in individuals that have intermittent asthma. They're in the 80s, as opposed to folks that have severe and persistent asthma throughout the day. Look how low that is. So they end up anywhere between the yellow and the red many times. Okay, so exercise-induced EIB, and also known as exercise-induced asthma. And what is that? Here's a famous athlete for you. Maybe you know who that is. He's not bad on the eyes. It's a transient narrowing of the airways during or after cessation of exercise and can occur in those with apparent asthma and those without apparent asthma. And so exercise being the trigger, and exercise being the trigger usually happens at higher intensities. So you may see athletes exercise at high intensity, so they may be, that's an added risk. EIV is defined as a decrease in the forced expiratory ventilation of about 10%. So 10%, it's enough to lead to the distress that they go through with the wheezing and the coughing and having to quit or rest before continuing on. It is, the good news about it is that it's self-limiting, meaning that if you sit down and rest, stop doing what you're doing, the high intensity work, it will resolve itself, and very rarely does it result in respiratory arrest or where you have to be hospitalized. When that happens, it's usually because there's some other type of infection going on. So it's a combination of other factors. It is the shortness of breath, the SOB, the coughing, the high-pitched wheezing that can be heard. That's signs and symptoms. But again, if they just sit out and stop the intensity of the exercise, and maybe if they're in a cold environment, they move into a warmer environment, that will take care of it. Avoid exercise tips, avoid environmental triggers. So thinking about case study, thinking about exercise environments, that's going to be important. So picking exercises that maybe are not exposed to the extreme changes in temperature would be a good thing to think about when working with folks with asthma. More consistent and predictable temperatures tend to work best. So we'll look at what types of sports may be selected for kids that may be most conducive to having asthma. We'll decide on that. So why is it that the symptoms of asthma increase during exercise? So why is it? What happens? So as exercise intensity increases, if you understand what happens during exercise, you're gonna, as intensity increases, you're gonna also increase your breathing rate. So more air is consumed. In order to do that efficiently, you have to also breathe through the mouth, and the mouth does not warm the air, and it doesn't humidify it like the nose does. So for folks with asthma, this may lead to further irritation, and irritation leads to inflammation. Inflammation leads to constriction, and voila, you have an exercise-induced bronchospasm. So that's how it happens. So warmer, wetter air is the best, and so you get more of that through the nose than you do through the mouth. So part of the recommendations for folks with asthma is to work on breathing techniques. So as far as medications, certainly that's part of prevention and part of treatment to be able to deal with their asthma condition. Symptoms can occur very early on in the exercise if the intensity shoots up very quickly. So that could happen. So it can occur as early as 5 to 10 minutes of intense exercise. So it can happen rather fast. In adults, they start later, and they tend to last longer than in children. Children are more resilient. As far as treatment to phases, in the early phases, as immediate reaction due to the airway bronchial constriction. So for that, they're exercising, and midpoint they start to wheeze. The treatment is to use the inhaler with usually beta to adrenergic agonists. That's what's in it, usually known albuterol being one of the ones that is used primarily. Let me move myself over again here. And they can also use it before exercise. Since you see folks that have asthma, you see some folks maybe at the gym, you see them using the inhaler before the exercise. It's more of a preventive measure in order to deal with, to try to prevent any exercise-induced bronchospasms. Sometimes it can happen after a stressor, right? So not right away, but you can have a delay. So if exercise is a stressor, it could happen 1 to 6 hours later due to the swelling in the airways and the irritation in the airways. So for that, then something more like a corticosteroid, Pulmicort, one of the brands used in a nebulizer machine that lasts a little bit longer than an inhaler, usually about 3 to 4 minutes. That may be something that I have to deal with. It does sometimes, individuals with asthma tend to know when they have more of a likelihood in the year to be susceptible to the allergy triggers, and so they can do preventive treatment by doing the Pulmicort, for example, in the morning and in the evening, and dealing with that to prevent it from coming on. Some precautions during exercise for folks with asthma: always warm up and cool down. As far as exercise or sports, short bursts of energy are better than those that require long duration runs. So track and field, or track being better than marathon running, for example. Not that you don't have world-class marathon runners that have asthma or cyclists that have asthma, but as far as your chances, you're better off with short burst types of activities, 100 meters versus a marathon. And in sports, baseball, better than soccer, but I just showed you, David Beckham, soccer, but you tend to have better chances in baseball. Try to learn to breathe through the nose as much as possible for as long as possible. It's a technique. And then use bronchodilators as needed and prescribed to prevent the onset and to deal with any episodes. Swimming tends to be really popular with folks with asthma because it tends to be warm and moist, and you're also horizontal. That helps with mucus. And the only concern, though, is the fumes if it's an indoor pool. So you need to be aware to check for trichoglycerin, which may actually be a trigger, and it's not something they want to be exposed to. All right. So people with asthma do tend to be less active overall than due to fear of EIB. So it does create a very scary experience for them when it happens. And so as a fact for that, what happens is they connect exercise with them not being able to breathe, and so that fear limits a lot of their activities, and so they tend to not do as much. So, but they can safely participate in any form of activity as long as they are properly educated, they have proper training, and they know how to prevent the attacks. Being aware of what the allergens are as well, because those tend to be triggers. We certainly do know that exercise places a greater demand on the respiratory system. Individuals with asthma are going to be at higher risk for EIB. And exercise is not going to be a cure for asthma, but they will have the same health improvements as someone who does not have asthma. And that overall leads to decreased hospitalizations, improved psychological mood, and decreased risk from other conditions, which what can happen if you have someone with asthma, then they become more sedentary, then you end up with obesity, and then you can think about all the other things that can happen: diabetes, heart disease, and so it's all a combination of other problems. So here is exercise programming for asthma and EIB. 3 to 5 sessions a week, 40 so that moderate exercise intensity, using the heart rate reserve. Remind you, the heart rate reserve is the 220 minus your age, minus your resting heart rate, Carbonin method. Focus on large muscle mass activities like walking, as opposed to the arm crank, for example, and work up to 20 to 60 minutes of continuous activity. Resistance training would be great, so that's not really any different. And work on the respiratory muscles would be good too. So other considerations, maybe think about yoga. Put myself over here for a minute. I'm all around. Oh, okay. yoga is about breathing. Yoga is about moving with the breath. So really all the thoughts and the focus is on breathing without being out of breath. So that would be about some good research on that. So that would be a good option for folks that maybe are not active at all and want to be more active to try yoga. Realize that there's a lot of variability in asthma, and you also have to look at any other pre-existing conditions or other factors that they may have. Consider longer warm-ups before aerobic exercise, more gradual movement to aerobic exercise. And then certainly longer cool downs, because remember that if exercise is the trigger, you could have an asthma attack afterwards, because it might have irritated the airways. That increased rate of breathing could have irritated the airways, and so the inflammation is not going to happen immediately. It could take some time. So yoga may also help. Like I said, yoga is about breathing, so yoga may also help to teach proper breathing techniques and work on the respiratory on the muscles involved in breathing. And EIB again is more likely in certain forms of exercise as well as certain forms of sports. And be aware that many folks may have a history of exercise-induced bronchial spasms, so they may have a fear built in. So you have to work with them on that. Think about, and they will let you know what types of activities have led to that. I know that when we used to teach at the Claremont campus, I used to take my students out to the track, the NTC track, National Training Center track, and we would do things in the track like run 400 meters. And I decided to do it one day. It was cold, and I always do things with my students. It was cold and dry, and I hadn't done a 400 in a while. I said, I'm going to do it today. Midpoint, I started to wheeze, and I hadn't had an asthma attack since I was a kid. But that high intensity, coupled with the cold air, and me having not run 400 in a long time, so not having the technique of how to do it right, I ended up with an asthma attack. Exercise-induced bronchial constriction, and it's only 400 meters doesn't last that long, so after I stopped, it went away. But it was certainly not something I was thinking that was going to happen, and it was a wake-up call. So you have to think about that when working with folks with asthma. Okay, so I'm going to have a part 3 and continue with chronic obstructive pulmonary disease. So see you on part 3. I hope this worked well. Bye.